Hi everyone to another episode of CCRM TV. I'm Dr. James Nodler. I'm one of the fertility doctors with CCRM in Houston. And again, I have with me our special guest, Dr. Abby Nodler. She is a psychiatrist. She works with all ages of patients, and we're just wanting to get her opinions because obviously in the fertility world there are a lot of different mental health stressors, and we're wanting to know how do we address those. And so in this video, we were wanting to talk about stressors specifically of male infertility. And I thought this was a really interesting topic because a lot of times we forget about the guys, right? So obviously I'm a gynecologist at heart, and that's the key, that's my patient. But the guys are an important part of this as well. And some of the specific things I was wanting to think about or talk about in this video, one are maybe embarrassment of some of the guys at even having infertility to begin with, and women feel the same. B is the same embarrassment about having to come in to collect in the office and, what are people gonna think, and as I go in. Then maybe anxiety and being nervous about maybe having to go to a urologist's office or having follow-up procedures or even a surgical procedure that some of the guys may have. And so I wanted to get your thoughts about those. But first, to start off with, maybe if there's some women listening to this, how should we talk to our significant other, the guys, about, the embarrassment or things like that, about, coming to the office, collecting in the office, things like that?
Yeah, and I would say just like for women, right, that sometimes this process is just part of it. Like we want to have a baby, this is what we're going to do, and it's accepted, and it doesn't provide any sort of psychological distress. For others, it might, and then sometimes in the male population, you worry a little bit about, are we communicating that, or are men?
Well, we don't communicate well. I'm just
are men internalizing it and not saying anything? And really, it is an opportunity if I could encourage people of all genders to speak up about what they're experiencing psychologically. It actually provides a very good foundation for us to connect, and connect with your team, connect with your partner, connect with those around you who are wanting to support you and who love you. That vulnerability is a challenge for some, but actually really, really serves to bringing us closer together and feeling more understood as a person. But again, it's not that way for everyone. But I would say too, just like we talked about in the job loss section, it could then start to develop our whole engulf our entire identity, right? I'm having fertility problems, so now I as a whole being am sort of less than or defective. And to be mindful, if that is something you're experiencing, to check in with your partner. Like how big of an issue, how big of a stress is this for you? And then maybe it's a huge stress for me and not for you, or vice versa. And it's something that we can talk about and connect around, and then seek help accordingly.
Yeah, and just from a clinical perspective, for a lot of the guys, we do allow guys to collect at home, bring in samples, and sometimes that helps. But one other thing that I wanted to touch on briefly is just maybe some guys having like a loss of self-worth, or feeling that they're kind of less than or not as good as they once were because maybe their sperm count's low or something like that. What should we do about that, or how should we think about that?
Right, and I think that's what it can be really nice when you're visiting together in the early stages, to share any concerns that you have, or apprehension, right, about what's the meaning of this. Like, does this mean, what do we do if we find out results that we weren't expecting? Or is it just the anxiety of the unknown? And to be mindful of the self and sort of together as a couple, so that you can sort of check in with your team and make sure that all of your needs are being met. And the psychological needs in fertility are huge, right? It definitely plays a role in how you seek treatment and how you engage with treatment, and the outcome of the treatment. So it is something that absolutely your team should know about, and you should be communicating amongst yourselves.
And maybe like we always say, load the boat, right? So talking to each other is important, but what I tell couples all the time is, I guarantee that if you start talking to your friend groups or your peers about fertility and infertility, I bet your spouse, I bet your husband or significant other will find that a lot of his friends or peers or colleagues or parents or siblings or things like that also similarly struggled with male infertility, and maybe that kind of lessens the blow a little bit when they see, hey, I'm not alone here, this is a normal thing.
Right. exactly. So getting that, like, sort of that normalizing the experience is a great way to manage it on the front end.
Awesome. Well, thanks again for joining us. We'll record more episodes. I hope these are helpful for you. Have a good night.